Hey everyone, this video is going to be a little bit different because it's for a class project. We'll be covering borderline personality disorder, a personality disorder that according to the DSM5 affects between 1 and 6% of the population, and about 20% of the psychiatric inpatients. Women are mainly diagnosed with it, however men can be diagnosed with it as well. They just tend to be more misdiagnosed with anger issues or depression. But before we look at BPD, I want to go over two construct issues: the person-situation debate, and the new method for personality disorder diagnosis. The personality debate goes more or less like this. Does a person or situation influence someone's behavior more? People on the person side will say that a person is an extrovert, therefore they influence their behavior. People on the situation side suggest something more akin to a person is not an introvert, their situation influences them to be that way. Here's an example to help make that more relatable. Let's say you have a guy named Steve, who's the biggest extrovert. He's always high energy and puts himself out there very easily. He is also the one everyone knows at parties. But at work, he's really quiet. Now here we can understand why the situation may affect him. However, just as a thought experiment, let's say that the factors that influence him to suppress his extroversion at work, like status, group pressure, or fear of embarrassment, enter his life outside of work. If this is short term, we wouldn't call him an introvert. However, if this pattern continued for over a year or more, he might start to be called an introvert. At this point in time, the debate has synthesized. Most people recognize the importance of both sides, but as far as disorders go, this suggests something important. In some cases, if the situation is heavily influencing a given person, then someone with a personality disorder may be reacting in a normal way to an abnormal situation. This abnormal situation may be continuously present, causing a fixed expression of quote-unquote personality. But this wouldn't be their personality, and it is important that they don't see their disorder as who they are, but as a part of their reaction to their environment in this case. The other thing to keep in mind with the personality disorders is the DSM-5's new classification. The way the new DSM classifies is in categorical notation. You have various symptoms, and if you have enough of these symptoms, then you have the disorder. This is similar to a medical model. You either have a cold or you don't. Likewise, you either have a personality disorder or not. The old classification system is a dimensional model that allows for levels of severity. In my opinion, this model is much more effective. You can have two people who share the symptoms, but one who has a disorder and one who is quote-unquote normal. To give you something more concrete, everyone's a little bit narcissistic at least some of the time. This model allows for that without it being a disorder for everybody. Those who get diagnosed are those who consistently act in that way. Keep this dimensional model in mind while we look at borderline personality disorder. Some of the diagnostic criteria for BPD include frantic efforts to avoid real or imagined abandonment, identity disturbance, affect instability, impulsivity, and others. One of the big issues for people with BPD is that of splitting, just meaning that they have a tendency to think in black and white terms. They either view themselves and others as all good or all bad in a particular moment. This causes fast changes in their mood, which in turn causes more issues in their relationships. BPD does have a tendency to be confused with bipolar disorder. However, the main difference between the two is that in borderline, the problems that underlie it are due to an intense fear of abandonment. A serious note before I get into causes and risk factors. I want to try and help destigmatize a diagnosis a little bit. People with this disorder are not psychos, nor are they crazy, and they definitely are not their diagnosis. Have you ever dated someone who is wishy-washy, and then you get to the point where you aren't sure if they actually care about you, and you get scared that they may break up with you? How about being afraid that your friends don't like you? If you've had any of these fears, you may be able to empathize. Bring the intensity of that fear and extend it to every single person you care about. You don't know when, but you're sure your family is about to leave you, that your friends will abandon you, and that your significant other doesn't care about you. However, the thing is that they do care about you, but unfortunately there's little they can do to make that feeling go away. That was my interpretation of the disorder based off of what I've read. However, I wasn't completely sure if this was accurate, so I went to a subreddit specifically for people with BPD, where I asked for a good description for those who don't have BPD. They said I wasn't too far off, but there are some descriptions I'd like to share. I've shortened some for time's sake. You know how young babies don't have object permanence? If If you take away the object, then it doesn't exist. Living with BPD means living without emotional permanence. If you're not there, not replying to my texts, not calling me, it doesn't matter if there's a logical reason. I can't comprehend that you're stuck in traffic where your phone died. I truly feel and believe that you no longer love me. You've left and you're never coming back. This can happen daily. It's agony. Think of the scariest moment of your life. Think of the absolute dread and terror you've experienced. Now think of all the times you've upset a friend or family member, even if they were only slightly annoyed with you over something you did. For sufferers of BPD, those two situations are almost identical. Every time a friend takes a slightly hostile tone against you, you're overcome with the fear that you'll never see them again, that they hate you more than words can describe, that you'll be completely alone for the rest of your life. The person with BPD reacts to that the same way a person without BPD would react if they were losing a loved one. In BPD, the miscommunication is about aching loneliness and losing your best friends. And going through that miscommunication scenario over and over is traumatizing and exhausting in its own right. Living day to day is much more intense. It's basically emotional chaos, always, until the chaos grows so big that you're feeling shut off to protect you. He or she continues to say, all you want is to feel safe and loved and not alone, but your brain is doing everything it possibly can to prevent that. Subconsciously, consciously, you are fighting a war inside your head every day. The more desperately you want to be with someone, the more desperately you push them away, but you don't mean to. I really appreciate the help of the Redditors in helping my understanding of the disorder. Thanks to those mentioned explicitly, and those others who helped. Okay, let's continue our look at BPD. What are the causes of borderline personality disorder? Honestly, we don't know. There are likely social, environmental, and biological factors involved, but we aren't certain. According to National Institute of Mental Health, family members of someone with BPD are 5 times more likely to also have the disorder. This implicates genetics, but again, we don't know how much. There's also a suggestion that early child abuse, neglect, or the death of a parent could be a factor in developing BPD. That being said, some people with BPD don't have a history of child abuse, and some people with traumatic history don't develop BPD, so we aren't sure. Treatment itself is just as complex as the disorder. The main treatments include hospitalization, medication, and psychotherapy. Some medicines include antidepressants, mood stabilizers, and antipsychotics. However, medication is prescribed very carefully due to the high suicidal rates of people with BPD and the possible suicidal side effects of medication. Counseling can be an effective treatment, but keep in mind that this disorder affects interpersonal relationships, and that can, well, probably will transfer to the counseling session. There are several types of therapy utilized for this disorder, and they include cognitive behavioral therapy, schema therapy, systems training for emotional predictability and problem solving, mentalization-based therapy, and dialectical behavioral therapy. CBT will help clients identify faulty core beliefs and behaviors that underlie inaccurate perceptions of themselves and problems interacting with others. Schema-focused therapy is a lot like cognitive behavioral therapy, but focuses on reframing schemas, namely the ones that have to do with self-image. Systems training for emotional predictability and problem solving is a group therapy that attempts to educate family members and others on how to interact with people who have BPD in a consistent way using the STEPS approach. This is usually done alongside individual therapy. Mentalization-based therapy, or MBT, is a psychodynamic style of therapy with a focus on attachment theory. It's developed mainly for those with borderline personality disorder, and its main goal is to help those with BPD learn the difference between their own thoughts and feelings and those of others, which is known as mentalization. To me, mentalization sounds a lot like theory of mind, or how we guess at the minds of others, and MBT suggests that clients with BPD have a deficiency in this regard. Fortunately, MBT suggests that mentalization is a skill that can be learned. Therapists in this theory work on helping the client learn and use the skill inside and outside of therapy sessions. Dialectical behavior therapy, or DBT, is the last type of therapy I'll describe today. It was developed by Marsha Linehan, who actually has BPD, for clients with the same disorder.
DBT is part of the third wave movement, those that implement mindfulness approaches with traditional CBT approaches. Another core concept is distress tolerance that allows clients to cope in more effective ways. Emotion regulation, boundaries, and interpersonal effectiveness are all topics that DBT covers. The therapy is very acronym-oriented, with ones like Dear Man, Give, and Improve, to name a few. However, these are just used to help clients remember strategies and techniques. One can teach and learn these strategies without the use of the acronyms. Alright, so today I covered some construct issues with personality disorders. I also went into borderline personality disorder, diagnostic criteria, possible causes and risk factors, as well as some potential treatment options. I'd like to thank the Redditors again for their help, and thank you for watching. Thanks for being you, and do me a favor and have a good day.